A mysterious illness referred to as Disease X is spreading in the Democratic Republic of Congo. This flu-like disease has caused significant concerns due to its high infection and death rates. The World Health Organization is working to understand and contain the outbreak. Since October, Disease X has affected an estimated 406 individuals in the DRC. The illness has claimed 143 lives, most of them children. Local health authorities are providing these figures, highlighting the severity of the situation. Here's a report.
Congo's health authorities issued the alert saying the government is on maximum alert over a mystery flu-like disease that in recent weeks killed dozens of people. Speaking to journalists at a virtual news conference organized by the Africa Centers for Disease Control, warned that the Panzi region of Congo province, where deaths have been reported, is already a vulnerable region, at risk of typhoid, malnutrition and seasonal flu.
It looks like a respiratory type illness. I said, it looks like. We only received the alert 4 or 5 days ago. So don't think that in 4 or 5 days, we can already identify the mode of transmission.
We
already have experience of Mpox. We have experience of COVID-19. So we'd like the population to be made aware of this new disease, if this disease really exists, to prevent it from spreading.
Authorities have so far confirmed 71 deaths, including 27 people who died in hospitals and 44 in the community in the southern Congo province. Of the victims at the hospitals, 10 died due to lack of blood transfusion and 17 as a result of respiratory problems. The deaths were recorded between November 10th and 25th in the Panzi health zone of Congo province. Authorities have said that symptoms include fever, headache, cough, and anemia.
We are really on maximum alert. We need to confirm through the diagnostics the suspicions around whether it is a respiratory infection. We must note also that in the Panzi health zone, there was a large typhoid epidemic 2 years ago, and that the malnutrition rates in this health zone are at around 40%. These are vulnerability factors.
Our hope, I say our hope, is first, we got quality samples. Second, when the samples will arrive to, will be tested to Kikwit, the outcome will reflect the true reality of what is going on in this region. For now, we cannot comment more. If we comment more on that, it will be just sharing remarks with people.
The Democratic Republic of Congo is struggling to launch an Mpox vaccination campaign in Kinshasa due to a vaccine shortage, as cases continue to surge nationwide, particularly among children. Head of operations for Congo's Mpox control program, said they currently have only 53,921 doses reserved for high-risk prison populations, but need for 162,000 doses to begin vaccination in Kinshasa's 14 health zones. Vaccinations have started in 6 other provinces, and France has pledged 100,000 doses, with additional shipments expected from Germany and the African Union. However, arrival dates remain uncertain due to administrative delays in processing orders and obtaining import permits. The dire situation in prisons, where unsanitary conditions heighten the risk of contagion, has led authorities to prioritize limited vaccine supplies for inmates.
Indeed, in prisons, since we have had confirmed cases in these prisons, ideally, in addition to frontline healthcare workers, we should vaccinate all contacts in the different rooms. I don't know how they are organized, whether they have dormitories or rooms, wherever confirmed Mpox cases are found, so that all contacts in these prisons are also vaccinated.
From October 28th to November 2nd, Congo reported more than 1,000 new suspected cases, 45 confirmed cases and 16 deaths. Cases among children have sharply increased by over 130% since mid-August to 25,600. According to Save the Children, which warned that children are nearly 4 times more likely to die from Mpox than adults and called for targeted vaccinations to protect them. Africa Bureau, WION World is One.
For all the latest news, download the WION app and subscribe to our YouTube channel.